afternoon, everyone. I'm Matt Biggerstaff, and I'll be talking to you about how we translate some of the information that's being collected into forecasts. Move to the next slide. So you may wonder why you want to forecast epidemics and pandemics, and we really know that surveillance data can provide us insights into what's recently happened, but what may not be happening in the future. And really, this is a critical component of public health to really think about changes and how we might want to send resources there, change our risk assessments, and get our healthcare systems prepared. And so forecasts really provide an opportunity to do this. And so when the COVID-19 pandemic hit in the US, we built our forecasting system on the backbone of FluSight, which was our flu forecasting system. This began in April of 2020, and we partnered with University of Massachusetts and Carnegie Mellon to make sure we got forecasts from lots of different groups, stored those openly, synthesized them efficiently, and communicated them clearly and evaluated those. We did this for cases, hospitalizations, and deaths at the national level, the state and territorial level, and at the county level for cases only. We had over 100 different academic, industry, and government groups participating, and we collected, disseminated, and synthesized millions of real-time forecasts, which I'll be talking through some of those lessons learned today. On this graph, you can see sort of the individual forecasts we got in on the top, and these are for confirmed deaths. And then we make an ensemble from those on the bottom, and that's what we communicated at CDC. And with all of these, you can see we have uncertainty intervals that are represented by the different sort of colored intervals there, with our more confident forecasts in the dark red and our less confident, 95% confident interval in the light red. And so some of the lessons learned from this experience is that individual forecasts show high variability in scale, but if we make an ensemble by combining all of these forecasts into one, that's really one of the most, is reliably one of the most accurate forecasts. Also, forecasts, including the ensemble, don't always reliably predict changes in trends, especially for cases, and forecast scale degrades as models are made, make forecasts farther into the future. So now I'll walk you through some of these results. So what you're looking at in this graph is on the top is an epi curve of reported deaths in US. You can see a few different peaks, and this is going from May 2020 on the right or left side for you, and then through November 2021 on the other end of that graph. And then you can see a weighted interval score, which is really a way that we sort of transform all of this uncertainty that we get into a metric. And it's really like a kind of an absolute error, but it takes that uncertainty into account when it's calculating the score. And lower scores are better for this metric. And the B graphic is 1 week ahead forecast, and the C graphic is 4 week ahead forecast, their evaluation. So the colors here, all of those gray lines are all of those individual forecasts that we got that I showed you earlier. So all of those different colored forecasts are now all the gray lines in this graphic. The average of those gray lines is the green or is the blue model, and then the green line is the baseline forecast. And this is really just saying what would happen if what happened last week sort of continues. So a flat assumption. So it's not a very informative baseline forecast. And then the red line is the ensemble. And so what you're looking at here is really to see that red line is often the sort of bottom model, which means it was the most accurate forecast for that week that the forecast was made. And this is really a consistent pattern over the epidemic. What's also really interesting, you can see those gray lines are really quite variable, and they change a lot over time. And you can't see this in this graphic, but different models are sometimes the most accurate, and then they can switch to be the least accurate. So if you're relying on one of these individual models to make your decisions, it can be really problematic. And so you're probably wondering, why do these models vary? And all of these different groups are using different methods, data sources, and make different assumptions about the future, like if we're going to keep social distancing in place. For the data going in, almost all of these, and these were mortality forecasts, use case data as inputs to their models. 10 used data on hospitalizations, 10 had information on demographics, and 9 used mobility. But a lot of these groups also use the data sources talked about here, like participatory surveillance from outbreaks near me. And we really need to understand how these different data sources can improve forecasts, because we don't have a smoking gun here. A lot of groups did not perform really well. And so the lessons that we've learned from COVID-19 is that an ensemble is a really good way for making forecasts from all these different groups. Forecast performance can degrade near inflection points. And if you're willing to go longer into the future, you might want to think about scenario projections. I didn't get a chance to talk through a lot of this given our time. And then I think as we're all thinking about building forecasting systems in the future, including for flu or other pathogens, we really need to think about the lessons learned that we've had during COVID-19. These were things we'd also learned in seasonal flu, and so I think we don't want to repeat these lessons as we sort of build kind of forecasting systems into the future. I just want to acknowledge the huge number of people. So these are all of the authors that were from publications over the years in some of these spaces. This represents literally hundreds of people from different areas working in this. So I just want to thank them. Thank you all.